cabinet spending the day in downtown Charleston.
That would be U.S. Secretary of Health and Human Services Robert F. Kennedy Jr., who spoke at the National Conference of Insurance Legislators this morning. Claire Weber was at the Francis Marion Hotel earlier today, where Kennedy shared progress in widening health care access. Claire.
The Secretary's remarks focused on sickle cell disease, a blood disorder more commonly affecting African Americans. He says he hopes to expand this work to all states, with South Carolina already on board.
Human Services Secretary Robert F. Kennedy Jr.
met with a standing ovation. Robert F. Kennedy Jr. is sharing the importance of his department's cell and gene therapy access model while giving a nod to the Palmetto State.
South Carolina has been an invaluable supporter, and states like South Carolina with high burdens of sickle cell disease have helped inform the design of our model.
Under the model, Kennedy says the federal agency negotiates lower sickle cell drug costs for state Medicaid beneficiaries. It's a familiar cause for Senator Tim Scott, who Kennedy called a champion for those living with the disease.
The fact that we're doing it here in South Carolina was a real blessing. I was really excited to see him come to us, because when you think about the sickle cell front, the fight, it is right here in South Carolina.
Behind closed doors, Kennedy, Scott, and other state leaders stressed the importance of lowering treatment costs, which can reach millions of dollars.
We heard from a patient, Janelle was here. She had had the gene therapy done, and now for 7 years she has lived pain-free, and that is huge.
Kennedy says 35 states, including South Carolina, have already opted in.
And it far exceeds the usual benchmarks for participation in CMS Innovation Center models, which goes to show that we are meeting a real need that states have for affordable next-generation therapies.
But his visit isn't welcomed by everyone in the Lowcountry. A small group of protesters were loud in their concerns with Kennedy.
He doesn't understand or care about science. It's killing kids. I'm very concerned about vaccinations, measles, and things we know how to prevent.
And some of his recent controversial views.
We need to get private insurance out of our health system. Our health system should not be a for-profit business.
Kennedy has recently faced criticism over his statements about people with autism and his plans to track the condition through a registry system. Working for you, Claire Weber, News 4.